I am a myofascial therapist, and people are like, "Oh, what's myofascia? Isn't that just muscle?" As I explained to people before, fascia is like a cellophane that wraps all the parts of the body, the muscles, the tissues, the organs. And you can have a knot in your muscles, but sometimes you can have something stuck in the fascia. So when you work with the muscles in the fascia, the goal is to get this fascia to kind of uncrinkle and to operate the way it should. Now, you can do it one or two ways. You can do it the correct way, or you could injure somebody. That's where training comes in. The one that we use a lot is, my favorite, is Michael Shea myofascial. It is a very efficient myofascial. It works really well with the body because it works with the body, it works with the breathing, the movement, and the function of the body. Acupressure, acupuncture, Oriental medicine. Yes, I understand it. Do I consider myself an expert? No, I do not. But that's why I have Everett Churchill as one of my referral partners. He's an acupuncturist. He knows this inside and out. Now, if I have questions, I can contact him and he'll give me answers, or I can send you directly to him. Reflexology. Do you know how to do reflexology? I've had training in it, yes. Do I understand it? Yes. Am I an expert? No. When Paul and I set up our practice, we decided that we would only do techniques that could be proven scientifically. One of the next studies I did was myokinesthetics. But myokinesthetics was developed by a chiropractor based on the fact that all pain is nerve pain. So he went through and he studied all the different pains and which nerve root they come from. Then he studied all the nerves, all the muscles along that nerve root. If you work the muscles along the nerve root that cause pain, you do remove it. This is a specific technique. I don't use it just as a technique, but the education I got from that, if you come in and say, I have a pain here, I have a really good idea where it is in here that you're having a problem. So that helps with me improving my massage. Yes, I have had more deep tissue work. Some of this stuff is deeper than what I can use in my practice. The other type of things that I've done just for information, feng shui, and these are just concepts that sometimes when you have people dealing with anxiety, if you understand a little bit more on how your environment affects you, you can help people just by listening to what they say. The micronutrients. This is a great reference tools for my clients so that they understand those things that are important. The latest that I've been doing is craniosacral. And I'm really excited about this technique. This technique taps into the fascial system, but it's really good for people who have had trauma or injuries because it's super, super gentle. This is the one that I've used on 2 of the 3 babies that I worked on in the last little bit because it works really well. When we got done with the massage school, Paul worked construction, and he had problems with getting horrible swollen lymph nodes on his body, and we're like, okay, does he have cancer? So we sent him in multiple times to get checked, and they're like, nope, he doesn't have cancer, he's fine. We found a lymphatic therapist in St. Louis, and they drained his lymphatic system. All the swelling would go away, he would feel so much better. So my next course of study was lymphatics. It was a 14-day intensive in Florida. So I do understand how the lymphatic system works. I actually aced this class because it was really interesting. There are between 6,000 and 8,000 lymph nodes throughout the body. This is a manual technique. All the things that I do are manual because touch, safe, healthy touch is extremely important. I don't use machines. It is all manual. So the 6,000 to 8,000, I know how to move the lymph. I can drain it for post-surgery, lymphedema. I can do it for detox massage. I also understand the compression therapy and how it works to work with people.